Good morning, Dr. Young. Thank you so much for spending a few moments with us to talk about how the BEMER technology has been important in your practice. If you would please just start off by telling us a little bit about your practice.
Hi, my name is Lari Young. I'm a physician here in Winston-Salem, North Carolina. And about a year ago, I decided to open a solo private practice called Thrive Integrated Health, which is a practice that focuses on preventive medicine, lifestyle medicine, and actually the treatment of chronic pain.
Well, thank you. And how long have you been using the BEMER technology?
I actually learned about the BEMER technology about 6 months ago when I was attending a medical conference from the Functional Medicine Institute. So it was back in June of this last year.
Great. So how specifically do you use this BEMER technology in your practice?
Well, since I'm the only functional medicine practitioner in my town that's actually trained in medical acupuncture, I tend to attract a patient population that has a lot of complicated medical problems that they've had for a long time, and many of which, by the time they find their way to my door, have actually exhausted the conventional medical system or have been refractory to the therapies that they've been receiving, or just plain frustrated that they're not getting any better. So when they come through my door, my orientation is to go after looking for what's at the root cause of their problem rather than just trying to treat their symptoms. So the BEMER technology has been a great tool for me because it actually, by addressing the microcirculation, allows me to really have a therapy that will treat the root cause of many of the conditions for which the patients have in my practice.
So can you give us a few examples of some of your experiences that you've had with the BEMER thus far?
Well, it's always great when you're talking about a product to have had some personal experience with it. So I can honestly say that when I purchased the BEMER, I was unwilling to even bring it into my practice until I had an opportunity to use it on myself. And I was a runner for many, many, many years and developed some low back pain about 12 years ago that was fairly debilitating, but I'd managed the discomfort of that pain through non-pharmacologic means, a lot of exercise and yoga and things like that. But the pain can be extraordinarily uncomfortable to the point that it keeps me up at night. I rarely have a good night's sleep. So when I brought the BEMER home to my house and started using it, I noticed that my pain was getting better. And by, I'd say, 6 or 8 weeks, I noticed that I was able to sleep through the night with greatly reduced back pain, which was wonderful for me. And actually now I'm back to running again, which is really awesome. So in the last 6 months, I've been able to return to some of the activities that I really enjoyed doing over the years. I'm sleeping better, and I have more energy. In terms of how I've used the BEMER in my medical practice, the folks that come in the door with these complicated problems, such as hepatitis C, for instance, I have a patient right now who has stabilized her viral load, who has improved her energy, is feeling great using the BEMER twice a day and just now sleeping on it at night. I have another patient with heavy metal toxicity and a long-standing problem with periodic fever syndrome, who's using the BEMER right now as part of a detoxification protocol that we're doing to rid his body of heavy metals. I use it on patients with, of course, with various chronic pain issues, be they joints or backs or just musculoskeletal or soft tissue problems. And I also use it on my fibromyalgia patients and folks that are just plain lacking in energy. So I have found a bunch of different uses for the BEMER that have all when I've used the BEMER, the patients have all responded quite positively to the treatments.
Well, thank you so much, Dr. Young, for these comments on the BEMER technology.